Hi, my name is Eva Steiner and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to I am super happy for today's interview, but before we start, can you tell me a little bit about yourself?
My name is Paulina Gołacka-Cisielska. I have two surnames. I live in Poland, in Poznań. It's in the west of Poland. I work as a therapist, just mainly with children, with teens and young adults. Right now, 80 or 90% of my patients are autistic. So it's the main group of patients that I work with.
Okay, so can you tell me a little bit about your culture? What is some holiday or tradition that your country celebrates? And if your culture would be an emotion, what emotion would it be?
The traditions and holidays, I think one of the most surprising holiday, I think it's different from other cultures, is celebrating a names day. We do not only celebrate birthday, but also name day. So every day has its own name. And for example, I have my names day on the 6th of June. So it's a kind of celebration. We invite guests. We spend time together. We do different fun things. So it's a very big tradition in Poland, I guess, especially in older generations. And when it comes to Poland as a nation, I would say it's changing, of course, but still, I think some of the most important days for our history are the most important days during the year, are the biggest holidays. I'm thinking about the 11th of November, which is an Independence Day, and I'm thinking about the 3rd of May, which is Constitution Day. Of course, because Poland is a Catholic country, we celebrate Christmas, and it's also very important. So I guess those two categories, I would say, are most important when it comes to our history and when it comes to religion.
And with the names day, then a lot of people with the same name can celebrate together as well?
Yes, but there are different dates for one name. So, for example, when it comes to Paulina, it's the 26th of May, it's the 6th of June, and some other dates during the year. And there's a tradition that you should have your names day right after your birthday. So the first day after your birthday is your names day. I haven't heard about it in a different countries, so I guess this is something unique, probably.
We have it in Slovenia, but it's not celebrated. You know, I know of this, but I think it's like 2 generations ago. It was probably celebrated, but I never celebrate Names Day. So it's nice to see a country where it's actually celebrated. So probably really unique.
Yes. My family lives in Portugal. And the little daughters of my sister, they completely are not aware of that they could, celebrate another date. So I think it's something probably not so popular.
And you also gift a gift to a person that celebrates, or it's more like a gathering?
Yes, you also get gifts and you give gifts exactly like your birthday. And for some people, it's even more important than birthday, I guess.
And if your culture would be an emotion, what emotion would it be?
I was surprised because recently I saw some videos and shorts on social media about Poland. I think Poland is getting more and more popular in Europe and probably around the world. That's really nice. And some of those shorts and videos were saying that Poland is kind of sad, or maybe not so sad, but serious, that we are serious and sad. And I think I wouldn't agree. Of course, not so many people are, smiling and cheerful, but I would say rather motivated or passionate. or determined. Yeah, so I think I would pick determined. That's the best word, which for me describes Poland as a nation.
Yeah. And how did you become a psychotherapist in your country, and what is your therapeutic approach?
Well, I'm probably not the best example of Polish therapist because I've had my training abroad and mainly in UK and then in the US. Now I'm in a training in the USA. So I was not trained here in Poland. My approach, I was trained in general in psychoanalytic approach and psychodynamic approach. Connecting different smaller approaches within this bigger paradigm. And now I'm studying a relational approach, an interpersonal approach. It's the one of the psychoanalytic schools in the USA. Not so popular in Poland. That's why it was so interesting for me to study there. I'm also a special education teacher, so I'm also a pedagogue. And because I, for a very long time, was working with children and adolescents, above all, I was connecting this relational approach in education or in pedagogy and this relational approach in psychotherapy. So I think I'm using both of them to work and to be with especially autistic children and adolescents.
And the recognitions of diploma from UK and United States, is it like easy to get it in Poland? You can just work as a therapist there, or you need to go through some process that the diplomas are recognized also in Poland?
It depends because most of all, I guess the problem is that psychotherapist as a profession is not well regulated. There is no official rules what you should do to become psychotherapist. Well, we have different schools, but there is no one way to do that. And people can do many different things to become a psychotherapist or a therapist. For example, there's different way when you want to be a certified psychotherapist in Polish Association of Psychotherapy. And there is a different way to do that if you want to be a psychotherapist certified by Polish Association for Psychiatrists. And there is a different way to do that if you want to be certified by Polish Psychoanalytic Association or Polish Psychoanalytic Psychotherapy Association. So there is no one general certification process that you should do, but different ones depending on school that you are in and paradigm that you choose to train in.
So each organization had its own rule.
Yes, and it's very controversial here in Poland, and for many years many groups are trying to change that, especially psychologists, but it's still not well regulated. On one hand, it's giving you freedom to do many different things and to connect many different ways of thinking. But on the other hand, it's making also a bit of a mess and letting people who are not well qualified to be therapists. So that's, there's two sides of that issue.
Yeah. Okay. So how society looks upon psychotherapy or any psychological help?
It's changing rapidly, I would say. It's different, definitely, than it was 20, maybe even 30 years ago, or even 10 years ago, I would say. I don't remember, for example, when I was a student, many people, for example, my friends or students around me going and having therapy. And right now, when I meet students, many of them are doing this and are open to this. Many celebrities are speaking out loud about their experiences and, trying to motivate people and inspire people to do that, to take care of themselves. So I think it's changing from the perspective that there's something wrong with you and then you go to therapy, to, oh, that's something I can do for myself and the way I can take care of myself, and go to a therapy. So I think we're in the middle of this, perspective shifting,
Shift.
change. Yes, yes, exactly. I experienced it as a very good process.
Can you get psychological help through health insurance, or you need to pay privately, or both?
You can do both. Health insurance is something we get from our government, and everybody has a health insurance, at least people who are working or they are in this institution who takes care of unemployed people. You can use this public system, but it's unfortunately still very poor in a sense. The offer is very poor. You have the appointments once a month or once every couple of months. So, well, I think it's not for people who are really in need of support. And it's more like consultation than psychotherapy. I think so. I don't know. I've never been working in this public healthcare system, so I don't know how you can work and what you can do for the patients working like once every month. So there is a huge offer when it comes to private care, and most of the institutions are private. And there are also NGOs, foundations, and institutions within the third sector, and they can help you get funds, or they get funds, external funding, to pay for the therapy. And it's happening especially for children and teens. There are lots of institutions which get external fundings, and you can get therapy for free in the private institution, but somebody else is paying. We also benefit from that. I mean, we as an institution, because I run a small clinic here in Poland and a foundation. We have also a foundation, and we also benefit from that. But we're in working with schools. And some of the schools are willing and glad to pay for the therapy of their students. So that's also a way to for the parents not to have to pay for the therapy, and to have it more often, to have it, in a place that they want to have. So we are looking, we are trying to find different solutions to help people, to support people, especially where and when they cannot afford a private therapy.
It feels to me like a lot of ways to educate yourself as a therapist, and also a lot of ways to get therapy.
Exactly. Lots of ways. And sometimes it's also a bit confusing for the patients, because they do not know about all of those possibilities. And it takes time to learn that, to get to know the possibilities.
Okay, so what is your society teaching about child-parent relationship, and whether this teaching also influence how you design your interventions with your clients?
I guess it's also changing, and you can see this paradigm shift or perspective shift. And if you asked me like 50 years ago or 40 years ago, I would say that there is a huge difference between the role of a child and a parent. And the relationship is very based on authority and respect for the parent. And now I think the relationship is getting more egalitarian. Maybe it's not a partnership-like relationship, but children, well, there was even a saying in Poland that was very popular in the 70s and 80s, that children and fish do not have a voice, that, they cannot say anything, that they are not allowed to speak and, share their opinions. Right now it's changing. I think many parents are aware how important it is to give your child a voice, how important it is to treat your child with respect, how important it is to listen to your child. I think that's a shift. So if you ask me about the situation of adult clients, I would say the role of the parent is not so important. And of course, they are frequently a very important topic in the therapy, but them as individuals are not so important in the process. Well, actually, I don't know how it is in other countries, but when the person is above 18 is the the borderline age in Poland between childhood and adulthood. When the person is 18, we as therapists are not allowed to get in touch with family unless the patient or the client wants us to and allows to. But if not, there is a confidentiality and we cannot, share anything with the parents, which is, well, as for me, especially when working with teens, a bit difficult because it's a process. For example, when I start working with a child who is 15 or 16, and then we are together still when he or she or they are 18, it's sometimes a bit difficult for the parent to hear that they are not allowed to be involved in this process as much as they were before.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue outside the therapy once the therapy process is over?
That's a very interesting question. And I'm really interested how other therapists you interviewed replied to that, because I thought that it's the same everywhere. I really didn't have a clue that it can, be other way or different. So I think it depends on the school and it depends on the paradigm you work in. But if I should, choose one general rule, I think that the relationship should be only within therapy, in therapy, not outside therapy. So that the contact outside the office or therapy room should be minimal and should be rather avoided. When it's over, well, I can tell you from my experience, my psychoanalytic psychotherapy, that it was a bit, I think I couldn't understand that the relationship had to end after therapy, even a very long one. The contact could not be maintained or continued. So it was very, very surprising for me, especially that right now I'm in a more relational approach, and it's the other way around. Like there is much more open approach to contacts in other ways outside therapy. For example, attending conferences, participating in seminars. And there is also this possibility to have contact after finishing therapy. But I guess here in Poland, it's I don't know if still, but there is rather this perspective that this relationship should be only in therapy, and then outside therapy or after therapy, there should be no contact. And it's a bit awkward if you have to be cautious not to participate in the same event as your therapist.
What about after the therapy process is over, regarding being a friend with the therapist or even enter the romantic relationships? What are the rules there?
No, I think it's even I would use the word forbidden. Well, of course, there are some, I assume, situations like that, but in general, when it comes to the ethics of your work, it shouldn't have taken place. So I guess it's forbidden, especially this romantic relationship. But in general, I guess it would be perceived as very not ethical here in Poland.
And do you have any organization or board that take care of cases where maybe the boundaries are crossed?
It's very hard because there is no general board. That's why I told you about the regulation and this one rule for everybody. Because when you're certified in different schools, only this school can take care of unethical acts or actions. And because people are certified in very different places and various places, it's very hard even to track what's going on. And it's very hard even to keep an eye on therapists, what they are doing with the patients. Of course, there is this Polish Psychotherapy Association and Psychiatric Association. But if the person is not in this association or is not, for example, certified psychotherapist and is doing consultation, they cannot do anything. On one hand, like I said, it gives you freedom to do many things and to study different approaches. And for example, for me to learn in another countries and to be inspired by different approaches. And on the other hand, is a bit messy and risky. And for people who are not ethical, it gives a risk of crossing the boundaries or even for violence, unfortunately.
And is supervision a must for a therapist in your country?
Yes, I think in every school it is a must. That's a condition for you to work, to have your own supervision and to be in your own therapy. Those are two conditions to be able to work as a therapist.
Even after you finish school and you get the certification and you work, let's say, for 10 years, is still a must, or then it's like your personal choice?
I think then it's your personal choice, but I guess in some of the schools you need to renew your certificate after a couple of years. So then you have to prove that you had your supervision and then you had your own therapy. However, I guess when you have this process finished, your own therapy finished, I guess maybe that's not the case, and you don't have to do it again. Maybe, probably, I don't know exactly. But it's unspoken rule, I would say. Like, I've never met a psychotherapist who would be reluctant when it comes to supervision, not thinking about supervision as a great tool and a great source of support.
Yeah. Okay, so what are the most common complaints that the client comes to therapy for?
I guess many different reasons. My clinic is focused on relationships. Well, in our clinic, the like people come and talk about their relationships. But if I try to get a broader picture, I think many people here in Poland are traumatized, unfortunately, and it's because our history and it's because experiences of the past generations, and it still needs to be, worked through, and this history has to be told, even if it's unconscious, or even I'm not saying that it has to be spoken deliberately or exactly like it was, but that's the reason. I think many people are also a bit unhappy and dissatisfied. And I guess it's in our clinic, but I guess it's also true for people in general, that they are lonely and they are trying to understand why they are lonely and trying to change that and to be in a, happy and satisfying relationships, different relationships. So I guess, yes, if I would choose one reason, I would say it's loneliness. That people are isolated from themselves.
How do you see this trauma showing through everyday life in Poland?
I would say maybe that's somehow connected to the word determined I used, because many people are very much task oriented, if you know what I mean. Lots of people are in a hurry. Lots of people are tensed, even in their bodies. I remember those shorts and videos that were trying to show people in Poland, especially in the eyes of foreigners, and they are always joking that people in Poland are never smiling, that they are grumpy, that they are, tensed on their faces. They are like walking very fast and not seeing people around. Of course, you can, it's sometimes funny when you see the whole nation, but I think this is, I would say this part of our traumatic experiences as a nation in the past. And I think many people are also very anxious. And I guess this anxiety can be also connected to trauma and in the past. I was also thinking about the relationship relationships in the families. But I guess this may be something more general than but not only connected to traumatic experiences.
What do you mean by relationship in the families?
That they are very, complex and not so good. And sometimes people decide not to maintain those relationships. They cut off from their families. They cut off from their roots. And they decide not that they don't want to change it, that they decide not to, understand it. Or what comes to my mind is the word disconnection. This is a disconnection. And I mean, with this loneliness, you can also see that people are disconnected, that we are disconnected from ourselves. So maybe that would be part of this traumatic experiences.
Okay, so if you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
To be and stay and keep myself open-minded, and to keep this attitude of not knowing, especially in Poland, because we are getting more and more differentiated culture, if you know what I mean. And I think that it's very refreshing, very inspiring, but also very hard, because so many differences come from the culture or from the environment where you grew. And I would like to be flexible and stay flexible. And like I said, to be open-minded, not to take those differences as pathologies, not to have a one pattern in my mind, which I would try to fit everybody in this pattern, because it can be very, very different in every individual, especially with this different roots and different backgrounds. So that's why I was so impressed and interested in your project, because it's really feeding my experiences right now, or it's like food for thought right now for me.
Thank you for doing this interview with me. I really enjoyed your answers.
Thank you. I wish you good luck, and many people around the world you would interview.
Thank you.